Meeting of our Health and Social Care Scrutiny Commission. My name is Councillor Victoria Olisa and I'm the Chair of the Health and Social Care Scrutiny Commission. Before we start the meeting, I have a few announcements to make about the meeting. As I said before, this meeting will be recorded by the Council and it's going to be uploaded to the Southwark Council's YouTube channel by tomorrow. So be wary what you say. Everything that we're saying in this meeting will be recorded. Please note, all guests will have their microphones muted. Can you please mute your microphone if you're not speaking when you join the meeting? And can you please leave it on mute unless you're invited to speak? Because if not, we'll have background noise from about 10, 11 people and we won't be able to hear what you're saying. Please wait until I've given you permission to speak before unmuting your microphone. So I might say, April, Ashley, do you want to speak now and whatever? Sorry, Ashley, April, so at least you're wary. Is it April, Ashley? Yeah, okay, because it's the other way around. So at least I'll indicate to you to speak. If the member of the commission wants to speak, could I ask them to indicate this via the chat function? If you look at the middle to the bottom of your screen, there's probably a chat function where you can type and say, I've got a question, so then I'll come to you. So at least I want to make sure that every commission members, I've got the opportunity to ask questions as much as possible to the speakers we've got today. Bearing in mind that a recording of this meeting will be posted on the Council's YouTube channel. If you're planning to speak at this meeting, you may choose to switch off your camera, because I know some people it's a preference. You may want to switch off your camera so only your voice will be heard. That's your preference. It's up to you. You don't have to have your camera on when you're speaking. Okay. There's members of the public who are disconnected from the meeting due to technical difficulty should use the link or dialing instructions, because when you look at the participants, I think we've got a few members of the public. Is that right, Fitzroy? If a member of the commission or officer loses internet connection or power, can you inform Fitzroy, Williams or Julie Trimble by emailing them or using the Microsoft Teams as immediately, so they can try and we can try and adjourn the meeting and then try and reconnect you as soon as possible. Okay. Last but not least, members of the public who are here are welcome to record, screenshot or tweet the public proceedings of this meeting. And as I said, the copy of the Council's protocols for reporting and filming is available on the Southwark Council website. And finally, in the interest of health and safety, as I said, we'll be taking a 5 to 10 minute comfort break at the end of each hour. So when it comes to about 10 to 8, we'll take a comfort break. I'll tell you, we're taking a comfort break till 8 o'clock. I'd suggest that at that comfort break, you switch your camera off, and then I'll come back at 8 o'clock and say, right, we'll check and see who's here, and then we'll restart the meeting. Is that okay? Because I know that a lot of people are just using screens and I'm trying to give as much comfort breaks as possible. Hopefully we should have a timely meeting and it shouldn't take too long. Okay. Has everybody got a copy of the agenda and all the supplementary reports? Yes?
Yeah.
Okay.
Yeah.
Right, let's go to apologies. Do we have any apologies for absence, Fitzroy or Julie? I can't hear you. You're on mute, Julie. Julie, you're on mute.
Sorry about that. No, there's no apologies. Just that Councillor Helen Dennis, as you mentioned earlier, had sent apologies for lateness.
Okay, thank you. And if I just go through confirmation of voting members, can voting members please introduce themselves when I call your name? Councillor David Noakes, Vice Chair.
Thank you, Chair. I'm Councillor David Noakes.
Thank you. Councillor Fleming's not here. Councillor Mary Lingford Hall.
Yes, Chair. I'm Councillor Maria Lingford Hall.
Thank you. Councillor Darren Merrill.
Yes, Chair, I'm here. Thank you.
Thank you. And Councillor Charlie Smith, are you there?
I am present, Madam Mayor.
Thank you, Charlie.
Who else?
Okay.
Yeah.
Okay, and if we go to number 2 on the agenda, there are no points of items of which the chair deems urgent. Agenda point 3, discussion of interest and dispensations. Does any member wish to declare any interest or dispensation in respect of any items on the agenda at this time? Yes, no? I'm taking that as a no. Okay, thank you. And if we go to item 4, the minutes for the last meeting, the 27th of February, I don't know if the commission members have a chance to have a look at the meetings from the last meeting. I know it seems ages ago. I think it was just before lockdown, 27th of February. So has anyone had a chance? Any comments, any amendments needs to be made? Because that's from pages 5 to 5 to 7. Any amendments, anybody? Yes, no? Okay.
It's okay.
Thank you. Okay, so can we agree those minutes are a true reflection of the meeting? Yeah? Agreed? Agreed, thank you. Okay, if we go to item 5, the impact of COVID-19 on residents and staff in care homes and the home care service. This is where we wanted to get an update from the council and the CCG on the commission of a PPE. I mean, it seems a bit, I suppose now we're coming to the tail end of sort of lockdown, testing how residents are staying in touch with family and friends in the wider world and lessons learned in protecting vulnerable people. Can I just start with Jeanette Laws, please, the Director of Commissioning, just to give you a quick overview and brief report back on that. Thank you, Jeanette.
Thank you, Chair. As you know, we went into lockdown in March, and as a result, care homes cocooned their residents, limiting visitors to essential professionals, community services, and a lot of the community services did shift their service delivery from face-to-face to telephone and digital offer, and staff worked from home where necessary. In terms of the council's response to lockdown and supporting care homes and indeed home care services, it really focused on the questions you're asking, which is around how we supported them in securing adequate PPE to fit with the guidelines, the PHE guidelines, how we ensured that they were financially stable in terms of, in some cases, having to recruit agency staff to backfill staff members who were either isolating or unwell or shielding, but also financial support as we went through the crisis in terms of increasing costs in PPE and so on. There's also, I'll give you some feedback about the support that we had from the CCG in terms of accessing testing for staff members initially, and then the work that we did with the public health colleagues locally in terms of testing of care homes. In terms of the support that we gave to the sector, it's probably important to say that probably the biggest piece of support we gave them, which was not necessarily financial, was around communication. So we worked really hard with providers to keep in contact with them. So at first it was daily, as you can imagine, moving to weekly. We had regular newsletters, which I drafted with support from colleagues across the council to let them know about changes in guidelines, about non-financial support we could give them, like free parking for our home care providers, so that the people could avoid using public transport. And we gave them advice about how to access PPE if the usual supplier was either letting them down, or in fact, in some cases, some suppliers were diverting their PPE to the NHS. That's sometimes been seized at customs, so it wasn't always the supplier's fault. We worked really hard with public health in terms of PPE, in terms of being really supportive to providers around their use of PPE, so how to put it on and take it off safely, to make sure they were using the correct PPE as we moved into community transmission and are now moving out of that. In terms of the visiting to care homes, we worked with providers to ensure that they were maximising the digital offer, and most providers were in fact trying to ensure that families and friends stayed in touch with their the service users or residents in the care homes. So there was a lot of use of iPads, and on occasions where family members really struggled with the technology, there were some creative ways to support visitation. That sometimes included being able to stand outside the home so that the resident being supported to see the person through the window. There were on occasions, particularly if, for example, a resident had experienced a fall, some homes actually provided PPE to family and friends so that a visit could take place within the home. In terms of end-of-life visits, because of the compassionate grounds, that was always done in a safe way. There was always PPE provided so that the person was escorted to the resident's room so that they could say their goodbyes in a dignified and respectful way.
Okay.
I know that there's probably a lot of questions about PPE. It's probably helpful to just talk a bit more about the ways in which we supported the providers in a practical sense. And I can give you some sense of numbers, which I think might be helpful to understand the scale of the problem that faced providers in terms of accessing PPE. So we provided in total over 800,000 pieces of PPE across all of our care providers. In terms of home care, that was over 720,000 pieces, nearly 728,000 pieces of PPE, and over 68,000 items of PPE for our care homes. It won't be a surprise to you, given that PPE at one stage was required for all visits, that this included in particular gloves, masks, at times goggles, depending on the whether the person had been identified as positive with COVID-19, and of course aprons, which were standard. And it's probably helpful to say in terms of the scale, particularly of the gloves, and I think this is really quite important, is to explain that when you're providing care, it's not as simple as a pair of gloves per visit. There were actually multiple uses of gloves in a visit because of the different activities that might take place. So the scale is quite significant. What was really helpful, I think, through the crisis was that the London boroughs came together, and you might have seen some press releases around this, but the London boroughs came together to undertake a procurement that was led by Ealing Borough Council. And they led on procuring just over 2.8 million items of PPE for South East London. Southwark volunteered to be the lead for the South East London hub. So we were responsible for distributing all of this PPE across the boroughs. I notice Councillor Noakes has got his hand up. Do you want me to carry on, or?
Yeah, if you just finish that, and then I'll pick up on I'll pick up with Dave.
Okay, thank you. So in terms of PPE, we have found a steady supply of PPE to support providers in terms of emergency supply. So we are not the routine supplier. We still expect providers to do that for themselves.
Okay.
And provision of PPE has stabilised. But what I would say is that there was a really interesting change in emphasis. So at first it was masks, face masks that were fluid resistant for the providers, which were difficult to secure. And we're now in a position where gloves seem to be the most in demand item of PPE that we're supporting our providers with.
Okay. Can I just interject here? David, did you want to ask your question now, or do you want to wait? Is it appropriate at this point, or do you want to wait till Jeanette's finished, because she might answer your question? She's finished her presentation.
Happy to wait, Chair.
Okay. Go on, Jeanette.
Thank you. So in terms of testing, this was something that, as you know, was paused by government and then restarted in April in terms of community testing, as opposed to as and when there was a view that someone may may have COVID-19. And the CCG were really helpful in providing us with access for staff members, not just only in care providers, but across the council, to be able to access the testing regime, which was the drive-through testing that you may be familiar with, as you saw in the media.
Yeah.
We at the stage at which it was introduced, I think there was less need for the testing, so the numbers were quite low in terms of the numbers that we put through. Okay. And what was really helpful was that when the government did make available testing for care homes, we worked closely with public health, who led on the testing, to ensure that our care homes in the borough were all tested. So far we have tested 12 of the 17 care homes. The 5 that are yet to be tested are because they are yet to register on the portal, and it was only recently made available to them that they can register on the portal. And that's probably important to say as well. So they've not been tardy, it's only a late availability to them that they can do that. And that's because the staging of the registration for testing of care homes was prioritised on older people care homes first, and then has now moved on to working age adult care homes.
Okay, thank you.
Okay, so perhaps if I pause there, because there's quite a lot of information, I'm happy to take Councillor Noakes's question.
Okay, so David, if you want to present, ask your question, please.
Thank you, Chair. Just a couple of questions. Well, some of these are just for confirmation, but can you confirm, Jeanette, that so we were told at a briefing, an adult social care briefing at the beginning of May, that we'd had 55 deaths in 4 out of 8 of our care homes for older people, residential and nursing. Can you confirm that the 55? Well, if you can you confirm what the current figure is? And secondly, can you also confirm that obviously the majority of Southwark residents are not actually in care homes in Southwark, and I'm assuming that their deaths therefore are recorded in whatever borough the home that they're in is based. Could you just confirm that, both those two things?
So yes, I can confirm that the number is now higher than 55 in terms of deaths in borough, and I can also confirm that there were deaths out of borough in other homes. We have monitored the number of deaths of our service users, regardless of where they are. We wanted to do that, adult social care, and ourselves. Partly because we wanted to understand whether our local, the impact on our service user population reflected the national population in terms of the majority being men, whether there was a higher incidence in terms of BAME communities. And in fact, that was the case. So we did see that. So we have monitored it, and I can send you the specific numbers if that's helpful.
Yes, please, if you don't have them present.
Okay.
Can I ask one other quick question, Chair?
Yes, David, yeah.
So obviously I know that none of the care homes are Southwark care homes in the sense that they're not directly under the control of Southwark Council. They're all private homes as such. In regard to obviously there's, some homes did seem to close down quicker, lock down quicker, and some homes, as I understand it, have managed to avoid deaths. I know that Southwark supported the situation when homes said they weren't going to take people in unless they'd been tested as the epidemic went on. But did Southwark Southwark take any sort of lead in requesting that the homes do lock down sooner, or would you see that not as being part of the council's role? I'm just interested because obviously some homes, as I say, seem to have managed to avoid any deaths in their homes, and others, unfortunately, have been very badly hit.
So the council did, as soon as we saw the government announcements, we did encourage homes to lock down. As soon as the government guidance was declared, some did lock down earlier than the guidance was published. But what I can say is we were in contact with all the care homes in the lead up to the government making that decision. We were trying to understand what their individual arrangements were with the care homes. It's probably also important to say that in terms of the deaths in the care homes, there is also an element that does need to be taken into account, because we have been talking about this, as you can imagine, a lot internally, in terms of the nature of the care that's provided and the needs of the people in care homes. So we do have some care homes which are nursing care, which do a lot of end of life. And so we would expect a relatively high number of deaths. There are others where they are working age adults who are relatively young in the care home, where there would be less so. And that's the kind of debate we've been having when we've been looking at the figures to try and understand if there are areas of concern.
Thank you.
Okay, any other questions for Commission members? Charlie?
Can you hear me? Am I on?
Yes, you are. Yeah.
Good.
Yeah.
Thank you. Would you like to say what you think the contribution has been by many of the mutual aid groups that have worked, this last few months, the contribution that they've made and how successful they've been?
So I know the mutual aid groups have done a lot of work with the community hubs, but alongside that, I know that there have been some voluntary, informal voluntary groups, I'll call them that, who have done work, for example, in creating face coverings for staff members. And I was put in contact by a counsellor in relation to that group to ensure that homes were aware of the work that was being done. We did receive initially, particularly when we were concerned about support for PPE donations, from members of the public as well as from some construction companies, which was really welcome and helpful when we were just starting out in terms of creating this bank of last resort, which is now well resourced. But at the beginning, I have to say, was we did feel quite vulnerable in terms of being able to support the sector. And it's probably, if it's okay to say it in this part of the question, because I was going to talk about some of the lessons learned. I think it's just important to also say that the frontline staff were absolutely magnificent in terms of the whole crisis, in that they carried on going, and we had lots of debate about the PPE, because they were quite, in some cases, scared, because the pictures they were seeing in the media were of people in full body gear, and that's the equipment that was needed in hospital, and they were trying to understand why their PHE guidelines were very different for them. So there were some really important conversations that needed to take place with providers and with the frontline work staff to make sure that people were getting what they needed, and that was important, and we were very clear about that. We did not want anyone to have anything less than the minimum guidelines, but we also had to be really honest about the fact that some of the things they were seeing in the media were not necessarily what was required to deliver safe care and in some ways compassionate care for people who were quite confused. And I have to say, I did in one of my newsletters write the fact that I felt quite humbled by the fact that people were continuing to deliver care. And when we were doing the welfare calls, we were finding that people were not missing visits. They were getting the care they needed. And I think that's just really important to say and to probably put on record.
Thank you.
Thank you, Jeanette. And I think if you can put on record that this commission commends all the workers who worked over and above throughout the crisis, because I think it goes without saying across Southwark that, and I think if you can pass our gratitude from this commission as well, because I think it's really important that they're told that, because I think unfortunately, in the social care industry, people tend to be told the bad news rather than be told thank you for all the hard work you're doing. And sometimes it is a thankless task. It's not for money, really. Is there any other questions for any other commission members? Maria, Darren, Charlie? And I suppose, Jeanette, if you can just finish off with lessons learned, because obviously we want to, I don't want to be the bearer of doom and say if there's a second wave, but I think we have to learn from this pandemic, but also at the same time prepare ourselves just in case, unfortunately, if anything else happens in the near future. So what lessons have we learned in terms of how, the council has dealt with this pandemic and the care providers?
So I think the lessons we've learned, some of them are about values, really. I think what we learned was that our relationship with providers is much stronger than we had understood, and I think that's really important. And our core values were very much the same in terms of really focusing on keeping the residents safe, residents either in a care home or in their own homes, but also the workforce safe as well. We found that collaboration across the boroughs really worked in terms of PPE, and I think it's helped us to think about how we do that in the future. And we certainly are continuing with the Bank of Last Resort in anticipation of a second wave, and I think that's probably helpful to say and reassure you that we're not going to do away with the Bank of Last Resort until there's a vaccine or treatment. So we will always now have a minimum number of PPE available. We interestingly, and you'll recall this from the meeting we had in February, the welfare calls which were undertaken by the contract monitoring officers, which was ringing the service users in their home to check they were okay, is something that we want to continue doing, even as we move back into whatever form of business as usual it is in terms of our contract monitoring. So we're not just going to rely on visits to, particularly for home care, to visits to their offices and looking at records. And we did talk, I think, at the last meeting about whether the lay inspectors may do that. But what was really interesting in terms of the welfare calls was two things. First of all, the service users really valued having the call. And that was something that actually the monitoring officers found really rewarding. And I just think that's an important dimension that really speaks to the values of the council around, treating our residents as though they're a value member of our family. So that's something that we are going to retain even as we move back to a form of normality. I think the other two things that I want to say, just important lessons learnt, are first of all around the value of the Southwark Ethical Care Charter. So what we noticed when we looked at other boroughs is that our number of staff members that were absent was lower than other boroughs. And we do think this was partly to do with the Ethical Care Charter. And we think it's important that staff feel valued. And so for that reason, the lesson we've really learned is that we do need to roll that out as soon as possible to the care home sector. And so the residential care charter, which is in our council plan, we really want to unpause that. So of course we paused it during the pandemic, but it is one of the priorities now for the relevant officer to finalise the arrangements in terms of the financial modelling, to understand what that means, just as we did with the Ethical Care Charter. So that's something that I think will be really important for going forward. And then the second and last thing, I think that was a lesson learned, and I just think it's important to say this, is that I think one of the lessons I'd learned, which probably was more pronounced during the pandemic than ever before, was the lack of understanding really in the Department of Health and Social Care, and also in some parts of the health and social care economy, about what social care is and what it's for. So sometimes you would find people would talk about care homes interchangeably with extra care, with supported living. And when sometimes people talked about care homes, they'd be talking about older people care homes without recognising we have working age adults in care homes. I think there was a lack of understanding about what care homes are for. The care homes are not just for getting people out of hospital. It's a home, and so the emphasis should be on home rather than just the care. And the fact that people live there and they're entitled to choose who comes into their home or not. And so the admission debate was quite important. So I think that's something that I feel that as a sector, we really want to continue working on. And I think we have tried to do that. We've talked about being the Cinderella sector, but I think we ought to be seizing on the profile we've had through the media to really ensure that people do understand what social care is.
Thank you. Is any Darren? Councillor Merrill?
Yes, thank you. I was I'm trying to figure out how to word this question, but obviously the NHS care homes have been concentrating COVID-19, but other medical interventions and procedures, have they started ramping back up again where they were delayed? And how have we compared whether the deaths, somebody might have needed, have we looked into the work on that rather than just the COVID, whether there's been some impact on other medical procedures from the COVID that may have caused a death of some description?
It
Not
might be
very well worded, but
No. I think I understand. I think I understand the question. I think I can only answer part of that. It might be that either the CCG or Public Health, who I know can't make it today, might be better placed to answer the second part. What I can say is we did see excess deaths compared to same time last year. We were monitoring that with social care. So and as you rightly say, not all the deaths can be attributed to COVID-19 because there was the testing was stopped. But we did see an excess deaths, and that's, I think, something important that we wanted to understand, really, like everyone else. In terms of services restarting, I know that we've been working with health colleagues around the renewal and the recovery of services to move back to as close as they can to where they were in a sort of COVID-19 world. And I'm not sure if the health colleagues on the call feel that they can add to the answer around that.
Hi.
Do you want,
I think Sam's got a hand up.
Sam, do you want it?
Yeah. So I think it's absolutely right. We'll Public Health are doing some work at the moment to understand some of this, the longer term impacts. We did have some of the services in the acute hospital did get paused during the height of the pandemic. However, the services that were being delivered by the GP enhanced service continued into care homes, as did the community nursing. So I'm not sure that I'm not sure I can answer your question fully, and I think that will be something that comes out of the work that's going on at the moment. But there were still services being delivered by the NHS to care homes.
Okay, thank you. Can I just pick up, David? You want to ask a question here?
If I may, Chair.
Yeah.
Yeah.
Go ahead.
So I just wanted to pick up on a sort of further question, I guess, around the care homes and the impact of COVID-19. There's obviously been quite a lot of talk about the extra costs that care homes have had to deal with in regards to the provision of PPE and the other impacts from the crisis, from the pandemic. And I just wondered, have there been any sort of conversations between Southwark and our care home providers about how they're managing in that respect, and whether there's any additional support required? Thank you.
So I can answer that in two parts. Yes, we've been having conversations from the outset, and where necessary, we were giving providers some lump sum money in advance to pay for the increased PPE costs, and that was alongside sometimes giving them PPE. More recently, you might have seen coverage about something called the Infection Control Fund, which we've been passporting to providers. So within the grant conditions, we have made that available to all the care homes. And only up to, I think it was today, I've signed off 7 invoices for payment of our 17 care homes. Part of the reason for that is because they do have to invoice us, and they do need to sign an agreement, because there are very clear grant conditions that the government requires of them in terms of accepting the money. But we have made that money available, and we are getting it out to the providers as they need it. I do think, and I might be going beyond the question, but it's probably worth saying, I do think it's worth saying that in terms of our local homes, because we have a small market, and because, if anything, we've been placing out of borough, the issue of vacancies is probably not as pronounced in Southwark as it has been in other boroughs. So the issue is more about increased costs than carrying vacancies. And it really speaks to the fact as to why we should still continue with our council plan commitment to open 2 new nursing homes so that we have people close to home.
Right.
Sorry, just as a quick supplementary, is that, do you perceive that in any way will be impacted, those plans to build extra care home spaces?
No, we don't. We still think we have too many people out of borough who could be in the borough and accessing our local services like the enhanced GP service, like Salam service to support people with dementia. If we have people close to home, they'll have the excellent services we have in the borough.
Yeah.
Thank you.
Thank you. Okay. Over to you, David. Did you want to add anything to what Jeanette said, or David? David Port Thornton. Sorry, not David. No, David Port Thornton. Sorry, David's here. David,
too many Davids, Chair. Apologies. Thank you. Just to briefly add, so to bring to the Commission's attention that in previous briefings you may have heard us refer to 8 care homes, and tonight you've heard Jeanette talk about 17 care homes. And just to explain the difference there,
I was going to ask then what I didn't know was increased overnight.
So initially what was happening was the support and the focus was on older people's care homes.
Okay.
And we asked government to ensure the risk was broader and managed all adults. So adults with learning disabilities, adults with mental health needs, adults with physical disabilities. So the government decided, they shifted their position and they moved to all CQC registered care home providers in the borough.
Okay.
And they also made a condition that the funding that was given to us to pass on would be passed on to all providers in the borough, regardless of whether or not we placed people with them or we had any relationship with them. So that was a catch-all arrangement for all care providers across all the care groups. So our official list then jumped from the 8 care homes that we were working with, positively jumped to the 17 in CQC registered providers in the borough. And that meant then that when we were working very close to NHS colleagues, we were able to have a comprehensive list of all the providers supporting all those vulnerable residents in the borough. And that's exactly where we wanted to land, because it meant then that when we were working with NHS colleagues on PPE or on testing or on advice and training, that it was comprehensive, and it helped us avoid blind spots for adults with learning disabilities, adults with mental health needs and others. So the official list that we talk about now for the borough is 17 providers, and that's the reason for that difference. And the only other point I'd really want to make is to reflect back that throughout this extraordinary time and the huge challenge that care home staff and home care staff have faced, this has been really a devastating experience for many people, and it is a huge testament to them that they've worked their way through it and supported people really, really well and supported each other well. And behind the scenes, in order to support our providers, NHS colleagues and neighbouring boroughs worked incredibly closely together. I've never seen anything like it before, actually, in my time, where there were daily calls about PPE, there were generous offers, making sure that we could support each other, and we felt able to step up because we knew we could rely on our neighbours in Southeast London, but also NHS colleagues too. And I would also just kind of call out that those conversations, we kept them real, we kept them supportive, we were focused on the issues, and I'm hugely grateful to colleagues for the support that they afforded us and supported our residents and staff in the borough. It really did make a massive difference in facing what was an extraordinarily challenging and very sad time.
Wow.
Thank you, Chair.
Thank you, David. And at this point, can I bring in April Ashley, please, from I think Unison Southwark, to give.
Yes.
Thank you, April.
Thank you, Victoria. I just have to go soon, so that's why I was coming just now. And I'd just like to say I will send some further information about what Unison campaign is on PP to Julie, so that the Commission is aware of our campaign on that. And I think basically Unison and the trade unions were campaigning on PPE and testing from the very beginning. And so we looked at the PHE guidance, and we campaigned on that. We spoke to our members, our carers, to find out what was going on. We did surveys about what PPE was needed.
Hang on, can you just hold on a minute, April? Can I ask everybody else to have their thing on mute, please? Because I'm getting feedback from, don't know who from.
Oh,
okay, thank you. Go ahead, April.
Okay, thank you. So yeah, so we campaigned on it from the very beginning, and we were always questioning the government on the PHE guidance, because unfortunately the PHE guidance about PPE was constantly changing, the PPE guidance, and so we had to keep going back to the government and campaigning so they could get the correct PPE, because we do feel that a lot of the guidance on PPE was about what the government could obtain rather than the health and safety of our members. And so we kept challenging them on what PPE was needed, and spoke to our carers and did quite a few surveys about that. And a lot of our carers actually didn't get the required PPE at the very beginning, and some of the providers were actually not speaking to the carers themselves about the changing of the PPE. So first of all, you didn't need masks, you only need gloves and aprons, and then the PPE guidance changed when we campaigned, but you did need masks, and then you did need goggles in some instances. So I think it was constantly changing. So it was really quite a challenging time for our Unison members. I might say no PPE, no care. We did, challenge the providers that, members, staff do need PPE for their health and safety. And even some of the providers were saying, well, actually, staff can't do care if they haven't got the right PPE. So we campaigned on it from the very beginning. And so, for instance, like Clap for Carers, I think carers appreciated the clap, but really what they wanted was PPE. So we changed that very quickly from just Clap for Carers to campaigning on actually not just a clap, we want the PPE on that, and it's really important for that. And so that's where we changed our emphasis on. We also explained to our Unison members and staff that if they didn't get the right PPE, then they have a right not to work under Section 44 of the Employment Rights Act. So they were make sure they were quite aware of their rights, and also about the risk assessment, made sure that the risk assessment is necessary, and they need to see that. And clearly, of course, we explained that Black members of staff were disproportionately impacted, and many of our carers in Southwark are Black, and so it was really important that they get the right PPE. And we looked at, and if you look at even the PHE report, obviously it's staff, the care work staff, and people who are publicly facing that is the highest risk of catching COVID-19. So we had a lot of information from sent it out newsletters. And I said I give Julie the links to the Unison website that we showed you with the surveys and on that. And also, I'm glad Jeanette mentioned the ethical care charter, because one of the issues that many of the carers and many other providers, not the providers in Southwark, that we were concerned about that staff wouldn't be paid if they were self-isolating or anything, or going off sick. And so the fact that staff in some providers only had a statutory sick pay, that means they're forced to come into work to be able just to survive. And so it's really important. We've got a campaign about that right now. Stop the spread of coronavirus by paying care workers, a proper wage. Full pay for carers is our main campaign at the moment. So if you haven't got that, then staff will come into work because they've got to be able to, pay the mortgage and feed, and eat. And so that was really important that we do have the ethical care charter, that when staff were self-isolated or sick, they got full pay, and that's one of our main campaigns. Is obviously PPE and full pay, and the £600 million that got for infection control. Again, we're campaigning on that, and we've written to the government about that to make sure that councils can effectively monitor it, because the main thing, we don't want this money just to go in the bank accounts of providers without any monitoring of that, and it just goes there. And because we know, obviously, the care homes are private care homes. They're not council homes, and we are always, Unison or Trainers have always campaigned for care homes to be brought back in-house, not to be private care homes, because we know all the problems with that. And it was noted that, you know, the NHS first got the PPE because they, you know, it is a state funded and the private care homes, so sort of left out, you know, in the beginning, and we do think it's because, you know, the NHS got strength as being in the part of the state, and the private care homes are privatised, and so they're not organised, and so that's where we are. And so I think from the very beginning, we gave clear advice also about PPE and what, you know, what PPE is necessary for members, and how they should be putting it in, putting it on and taking it off, and things like that. So we have lots of information, and it'd be taking forever to me to give out all the information today about the advice we gave to members, how we campaigned with members, and we spoke to members and surveyed members, and we're still continuing the campaign. That's the main issue. It hasn't stopped. We're still continuing that, because you know we have the two private care providers that have got the ethical care charter, but there are others I think we still do use that haven't got the ethical care charter. So we're still really concerned about those, to make sure that staff are paid correctly, and they've got all the PPE. So I think it is continuing the campaign, and yeah, we will continue to, you know, work with the council on that, and the providers. I've contacted David and Jeanette quite a bit about this issue, and so we'll continue to do that. So I think that's really the only thing as I want to say, and I'll give the information to Julie so that the council can see that as well.
Okay, it's just a question from David. Did you want to ask a question, Charlie?
Oh, sorry, and there's one more thing I forgot to say, sorry. It's just the testing is, obviously we can pay for testing, but we're also concerned about the tracing and the tracking, how that is working with the test, trace and tracking. So I know that's still early days, but we're really still concerned about that as well.
Okay. Thanks for that, April. I know that you've got to go. Can I take a question from David Noakes and then Charlie Smith? David Noakes?
Thank you, Chair. And thank you to April for your for speaking to us tonight. I'd obviously like to add my thanks to all the staff in the social care sector, because they have absolutely been on the front line, and I know that they've done amazing things to continue to look after people in our care homes. So thank you for that. I just wondered if April can comment. Obviously, you talked about the problems that the care homes had originally in getting the appropriate PPE equipment. To your knowledge now, is there enough PPE equipment and the right equipment for care home staff? And also, are you able to comment at all on how easy it is for members of staff to get a test, to get tested themselves? I know there are testing centres, but I think quite often you have to drive to them. And I just wondered if there's any other way, if you don't have a car, that staff could get tested.
Okay, yes, so I've spoken to staff and providers, and yes, they are able to have the adequate PPE. One of the main issues at the beginning was the masks that they actually didn't have. And one of the main issues at the very beginning is that they had to go, there was no information coming from the providers to the staff about what sort of PPE was required. They may have had it on their website, but the local managers wasn't discussing that with the staff. So so London Care may have had quite good policies about that. The local managers were not discussing it with the staff, and so they had to go and sort of actually beg them for the PPE, but then it did change, and as we campaigned, so they weren't getting the correct PPE at the end. The testing, I've not had any issues about testing at the moment for the staff, the home care staff. As I understand, they are able to get the testing. They can go in and either drive-through testing. I mean, that's obviously, but they can get the testers that comes home to them. So they've not raised any issues about testing with me at the moment. I think we're quite concerned about track and trace, but I understand they can get tested. So I've not had any complaints within Southwark about the testing from members of staff.
The Miners Association is an impartial voluntary
Okay, Charlie, you had your hand up?
2 hours a week, giving free valuations on Opal. Yeah, well, what they're doing in there.
That's all right, Chair.
Okay.
That's been mentioned and answered in the last answer. So thank you anyway. Thank you.
Okay, thank you for your time and your feedback, April, and and I'm pleased to hear that with the Ethical Care Charter, that's really made a difference to supporting staff, because I think it's important that compare our staff figures to other boroughs. The Ethical Charter has kicked in and supported people, so they've made those concrete decisions on health rather than just economic, financial decisions. I think that's really important. At this point, I make it 7:57, so I said we're going to have a comfort break at 10 to. Can we have a comfort break now till 8:05? Till 8:05. So if you can switch your cameras off and we're back at 20:05. Okay.
Okay.
Thank you.
Okay. Bye. I'm going now.
Bye.
Okay.
Fitzroy, you can speak. Okay. You can stop recording now. We're going to break now till 20:05.
All right, Chair. Thank you.
Okay. When I come back, I'll let you know. Okay.
Rightio.
$500, putting their season. They are going to be really good. We're still with that.
Fitzroy, are you there?
Yes, Chair.
Okay, hi, I'm back. I think I'm literally on time. Hi, Darren.
Well, you're good to go whenever you're ready.
Let's see how many people are here. Let me see. All right, okay. Who's missing? There's one person missing, but okay, right. If we go on to item number 6. Right. Item number 6, the scrutiny review of the care home and extra care quality assurance. I don't suppose if everyone's had a chance to have a look at the draft headline report, which is pages 12 to, let me see, 12 to 42, which is attached to the agenda. Because that's basically just for general comments from any members. Anybody else?
Chair, are we?
Chair, can I ask?
Sorry. Oh,
Sorry,
Fitzroy, are you recording?
Okay, yeah, that's fine.
Yes, Chair. I don't stop recording when the meeting goes.
All right, okay. I thought you stopped when everyone went for a comfort break. Sorry.
Okay.
I'll put my hand up. Hang on.
Okay. Hang on. Let me just check and see the conversation. Okay. David Noakes, did you want to make a comment at this point?
It was just really
put your hand up.
Yeah. Sorry, it was just to seek clarity, Chair, on how you wanted to proceed with this item. Are we going to go through the recommendations? Is that the idea, or
right?
Or you just?
I think I just wanted to get some and it's general comments for us, and also if you want to go through the recommendation, because obviously I've seen the recommendations, but I just wanted to get some general comments, and then if you want to actually clarify, if you want to highlight some recommendations, or we can have a further discussion about that. Okay, David, do you want to start with you, and then Helen? I think Helen's got a hand up. So, David, next.
I wasn't necessarily going to. Well, I was wondering if we can we go through the recommendations? Is that the best way to do it? Is this our last meet? This is our sign-off meeting, is it? On this particular set of recommendations.
We could probably have a final sign-off if Julie agrees with me on the final meeting on the 16th of July. Because we've got another meeting scoped in the 16th of July, and that could be the final sign-off meeting. So I think for us today, this is the fuller draft than we've ever had. So we can have any comments, we can add an additional, and then have the final sign-off on the 16th of July at that meeting.
Okay.
I think that sits in the cycle with all the OSC and all the reporting back to Cabinet, etc. Yeah, is that right, Julie? Yeah? Yeah? I can't hear you, you're on mute. You're on mute. Julie.
Yes, that's correct.
Yeah,
yes.
I was going to say you're on mute. Okay. So right, hang on. Let's have a look at. Right, let's go back to recommendations. Let's see. Right, if we look at. If we look at, I think for me, look at the recommendations, I think starting from family, friends and advocacy. Does anybody want to comment on those recommendations? Because we're saying ensuring systems are put in place to ensure people in homes in and out of Southwark who are unbefriended have support by the independent lay advocacy service or similar. I suppose that touches on what Jeanette was saying earlier about supporting people who are service users in and out of the borough, but also what we want a recommendation to say, ensure there's effective systems in place. Because I think when we started this civic cycle year, we were asking about the percentage of our service users, residents who are receiving care out of the borough. So we wanted to make sure there's a system, effective system that's supporting our service users, our residents in borough, but also out of borough as well. But I think that recommendation goes on to ensure that systems are put in place to make sure we are befriending them and supporting them. And we also have care homes have regular meetings for families and carers this ought to happen at least quarterly. I mean, there's not assumption that it does happen. I think in some boroughs, in some care providers, it does happen, but have a system where it happens on a regular basis. Does any of the members, commission members, want to comment on those two recommendations? The family, friends and advocacy, the slide number 3. Darren, Heron, Charlie, David, Maria.
Can I ask a question, Chair? Sorry, it's
Yes,
Helen Dennis.
Yes.
Hi, sorry, and sorry for missing the important item at the start of the meeting. It was a question actually which just flows from that section, because it obviously talks about the older people's hub. I just wondered if, because I've heard about the hub in fairly general terms, and I know that it's now kind of up and running. I don't know if there's any officers on the line who could actually give a brief outline of how that's kind of working now, particularly in the context of COVID on a day-to-day basis, but kind of how they see that essentially fulfilling some of the recommendations essentially around kind of support, providing information for family, friends, etc. Is there anyone who could just give a little bit of a some background on how that's currently functioning?
Jeanette, maybe? Yeah. Jeanette, you're still on mute.
Sorry.
Okay.
Yes, happy to answer the question, Chair. The hub isn't quite fully functioning yet, because we were just starting mobilisation as we went into lockdown. But one of the things we recognised was that we did not want to pause it. It's one of the projects that we did not pause during lockdown. So mobilisation has continued to stay on track with the go live date of the 1st of July, which is on track. So we will be fully live from the 1st of July. But the services that are part of the hub have continued where possible. And so one of the things that it has been looking at is how it continues to provide information and advice. Interestingly, one of the things that the homes have been looking at, because of course with the lockdown in terms of cocooning visitors, they've been doing some creative pieces of work around how people can visit care homes when they're being admitted. So we would want the hub to be able to support that. And it might be that the committee might want to hear more about the hub once it's fully up and running, and I'd be very happy to provide a briefing paper about that. But I just wanted to manage expectations that it's not fully up and running quite yet.
Okay, but Jeanette, can I just have a question to follow up from what you just said, that some of the services out the hubs have continued. So services like what? Can you be more specific?
So support out for discharge out of hospital if someone's going back to their own home. Those kind of services did continue, yes.
Right. Okay. So when you say
shopping in and things like that.
Right. So just to be clear, like you said, following up from Helen's question, from the 1st of July, it will go live. Literally everything will go live, and all the services, all the information, advice and guidance should be available for family, friends and whatever. Helen, did you want to ask a supplementary question, or does that answer?
I think it would be helpful at some point in the future to receive a fuller briefing on that. But it was just more because it wasn't, in some respects, when you look at the section on family, friends and advocacy, it's mentioned but doesn't appear specifically in the recommendations.
Right.
I feel like the recommendation is quite broad. The first one, ensure systems are put in place to ensure people in homes who are unbefriended have support, etc., or similar. I think these could be tightened up a little bit more. Just in terms of just holding accountability, I just like things being as really tight and specific as possible. So it references the independent lay advocacy service, and the second recommendation talks about care homes holding regular meetings and quarterly, so that's good. But I didn't know whether there should be something specific here on the older people's hub as well, and the role that should be playing.
Okay, if you feel that, if you can send that to myself and Julie, and then we can actually scope that in, because like we said, this is not the final draft. Do you see what I'm saying? So your contribution would be really well if you can, send us those specific recommendations. We can add that in, because you know, if we can get it drill it down as close as possible, then it's a case of when it is finally presented at the end of July. It's got.
And I'm conscious that I'm coming to this quite fresh because
that's fine, but also that helps us as well, because then you're coming with a fresh approach on you, like, oh, here we go again. This report has been around 6 months, and I think I appreciate that you've come back and you've given your objective opinion, and I think it's important that you send that to Julie and myself so we can add it to make the report as relevant as possible. Sure. Yeah,
will do. Thank you.
Yeah. David, did you want to come? David Noakes, sorry, because I keep remembering there's two Davids. David Noakes, did you want to come in and say anything about those recommendations, or?
Yeah, it's just to sort of pick up a bit on Helen's point, I guess. I think recommendation 1 around, I mean, I agree with the sort of intention of the recommendation to, you know, to support people in homes who haven't got any family, and to do that potentially through the Independent Lay Advocacy Service. But I just think we need to think practically how that's going to work, because you know, how they're going to be, who's going to make them aware of which people in the homes don't have any support mechanisms. And also they, you know, I think their level of visits is quite limited. But so yeah, I think we just probably need to think a little bit more about tightening those recommendations up. And just making sure, I guess, I mean, it'd be perhaps helpful to get some feedback from Age UK just to see what they think. I don't know if we discussed this recommendation with them, but just make sure they're on board with that. I like the intention, as I say, but I just want to make sure it's going to work in practice.
Thank you for that. So as I said to Helen, if you can think of wording or think that something, how to make it, tighten it up, then you can send that to Julie and myself, because it is a working document for all of us to work together to get a report that's going to give the proper scrutiny, because I think it's probably one of the first times that care homes and social care area has been looked at by any scrutiny committee, whatever. Well, I've been told it hasn't been done before, so I think let's start with a good foundation and carry on from there, really. Let's next set of recommendations. I'm trying to, because I'm looking on a split screen here, so I'm trying to look. I think the next set of oh, hang on a minute, it's gone. Sugar. I think the next set of recommendations.
Sorry, Jay, you did miss one set out, which was on page 23 under quality alerts and complaints.
Okay, let me go back, because I've just find it on my other screen. So
it's on page 23 on the side.
Yeah. Page 23. Okay. Sorry.
The headline is.
So yeah, quality alerts. Is quality alerts quality alerts and complaints number 3.
Yeah.
Yeah. Did you want to say something about that, David Noakes? All right, okay, because I think this is something that's still outstanding, Julie. It's about what is the council doing on complaints investigation, because that's one of the, I think Bill Williams mentioned that one of the early meetings about complaints. Can we do comparison of complaints with other relevant boroughs who've got the same number of care homes that we have? Because at the time we didn't know what the complaints were about. We have 1 or 2, but we hadn't had a good handle of overview of complaints, the themes, benchmarking, but also have some comparative analysis with other boroughs. Right.
Yes. So. Yeah. So the first one. So the second one is linked up with the annual care homes report, which I think was something that Jeanette suggested actually at a formal meeting, that there is a report in about annual care home, an annual report about care homes. And so one of the recommendations of Mid Staffordshire is that it's good practice to keep a summary of complaints and quality alerts, and to benchmark as well. So that's, which had also been discussed at the previous scrutiny commissions. So that was one of the rationales behind there. That's the very last recommendation, but the one above from that was also about the complaints process, and I think Jeanette's going to provide a further report just giving a little bit more information about that. So that recommendation probably could be tightened up once we've got a bit more clarity about the present process. Yeah.
Thank you, Julie. Jeanette, you've got your hand up. Let's go on, Jeanette.
Thank you, Chair. Yes, so in terms of there is some outstanding information that we were waiting for. Unfortunately, as we went into lockdown, I've just not chased up that information. So I am speaking to other boroughs now to see if we can secure the information. But there is a heavy, I should say, health warning on the information that I'll be sharing, because all our markets are slightly different in terms of size. So that has to be taken into account. But colleagues, certainly in South East London, are saying they would be willing. But of course, even within South East London, we're all very different. So it's important to say that, really. But the information is on its way, and we're hoping to have it with you by or before the 3rd of July.
All right, okay. 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 David, and did you want to mention anything there about those recommendations, or yes, no? Okay.
Well, only I guess I mean, in regards to the complaints procedure, this does seem to be a slightly recurring theme. I mean, we have actually, Chair, I'm afraid, looked at care homes before in the past, and there does seem to be a bit of a recurring theme that I'm not totally clear why. I would like to think it's in the contracts that we have with the care homes, that they've got their sort of complaints procedures clearly up, and how to make a complaint, and also how to raise a safeguarding concern. And I'm never quite convinced that ever happens.
Right.
So obviously, I'm very much with the sentiment of the recommendations, but I think it needs a bit more sort of vigor behind it, in a sense, and I hope it's sort of in the contracts that we have with the care homes.
Okay.
Maybe it's not, but it feels like it should be.
Yeah. Point taken. I hear what you're saying.
Could I just clarify? Yes, because I think it's really important to say that as part of CQC regulations, complaints is a really important part of that. So it is in there. It is in the contracts as well, that we expect them to fully investigate complaints. So I think I think the sentiment's asking about how the council and the CCG investigate those complaints where it comes up in a care. That's how I read this. You wanted to know how we did that, but I'm very happy to clarify. It'd be helpful to clarify what you'd want from us, because that's what I was going to describe.
Yeah, I think it's important that, because the clarity of what complaints procedure we've got, and making sure that if there's a complaints within the provider, what system have we got in place to make sure that, because at the moment it's a bit, and also comparison, because I think the question from Councillor Williams was like, how do we compare with other equivalent boroughs as well? Because we can say, oh, we don't get that many complaints, but in the context of how are we actually checking those complaints, and are we waiting it becomes a serious safeguarding issue? Do you know what I mean? Have we got any near misses and whatever, and have we actually got a robust complaint system in play at the moment? And I think that's why that was put in there. So I think, I take the point that a lot of these recommendations, that's what we're trying to do. We're trying to tighten them up as much as possible to make the report fit for purpose. So when it does go out, it's quite clear what we're asking and what in our scrutiny. I'm going ahead. I've done the family recommendations. Right. Recommendations, slide 32, lane inspections. Maybe this one needs to be broken down, because it says the Commission endorses the organisational commitment shown by the Council and Age UK to restart the lane inspection programme and establish complementary strong working relationships. Maybe we need to break that down to say, what does that look like? Because yes, Age UK, but it's like, maybe we need more detail, because I think we had a report back from them at the last meeting saying that they're reviewing how they're going to deliver that programme. And obviously the important thing is about having the family and the service users family voice. So it's about, let's see what that looks like now. It's now, what, 4 or 5 months since we've heard from them, and let's look about what's that going to look like in terms of the lane inspection programme, because I think lane inspection programme version 2, because it's been revised, rebooted, but also how is it going to work, especially after COVID-19 and whatever. COVID-19, unfortunately, it's pandemic. However, what's come out of that, it means that we always have to work differently and better as well. And is it a case of talking to Age UK about the lay inspection work and saying about, yeah, as we said, we have to tie into contract management, but is it asking slightly different questions as well, drilling down to the key points? Does anybody else want to say anything about that recommendation, or anybody, Darren, any of the members? David, have you still got your hand up, or is that from last time? David,
there's a new point, if I may, Chair.
Okay, David, go on. Go ahead.
I wanted to ask, in that recommendation, it talks about the annual report, about having an annual report on care homes.
Yeah.
Is that a recommendation from us, or that's something that already exists, which we're just sort of adding our recommendation into that? Does the council currently produce an annual report on care homes?
I don't think.
So no, we don't. We do for home care, but we don't for care homes.
Okay.
But I think maybe this, all right, I'll get to you, Nancy, in a minute. I think maybe this recommendation saying that maybe in an annual report on care homes, if we don't do one on care homes, why don't we? Because I think it's about, we're saying about people need to know about social care, but also I think the issue of care homes is slightly different from social care in its entirety. So I think it's about saying if the council doesn't do an annual report on care homes, are we suggesting they do one, or are we suggesting that they do something short of an annual report, so you don't keep our eye off the ball, really? Because now we've actually drilled down into care homes and what's happening over this year. Are we just going to say, okay, let's just leave it aside? I think members have to think about that. Do we want to recommend that there's an annual report on care homes, or do we feel that that's not needed?
Chair, if I may say, sorry, I'm to jump in. I think with the emphasis on things like the residential care charter, which is I think why we do now have an annual home care report, because it was trying to understand the impact of the the Southwark Ethical Care Charter. I see that this could potentially dovetail in that in supporting how we ensure that the residential care charter has the impact we're expecting.
Right.
So with the scrutiny you're having on the quality assurance alongside the residential care charter, that could be an interesting recommendation.
Okay. I'll take a question from Helen, and then also one from, is it Maria? Have you got your hand up? Yeah.
Yep.
Yeah. Helen, please.
Yeah, thanks. Just to follow on from that, Jeanette, actually, just a quick question. It would just be useful to know how the annual home care report kind of, like, where does it go? Does it come to scrutiny? What is the kind of role? Because as you said, it would be helpful if it probably mirrored that. It sounds very positive, and it sounds like something that would be quite helpful to have. But it'd just be useful to know kind of how scrutiny plays a role in considering that report. Thanks.
Question. Yeah.
So at the moment it goes to cabinet, and I'm afraid I don't know the history of it. When I arrived, it always did, but certainly it goes to cabinet, and it could something in the future that could. I'm not sure, but perhaps it might be helpful if we brought it to scrutiny before we go to cabinet, or after. I'd have to talk to the lead member to understand the appropriate governance, but it's something that certainly in the future we could do, and one is coming up soon in the autumn.
Okay, thank you. Maria, I'm coming to you. Sorry, before Maria, can we go to Nancy, because she had her hand up just before you did? Sorry, Maria. Nancy?
Yes, hi, Victoria. Sorry, I hope it's okay if I just come in.
Yeah, that's fine, because you had a hand up, yeah.
I'm one of the clinical leads from the CCG, and I suppose I wanted to just speak a little bit, because I think this is an opportunity for us as a growing, a developing borough-based board, because this could be a really good topic for us to review from a quality point of view. Because as I read this report, I think it conflates two issues. One is the actual detail on the quality aspects of the care home. So, for example, you've written down GP services need to be well monitored in one of the conclusions. Of course, that's absolutely obvious. But then there's also the role of the scrutiny committee in assuring itself that the council are doing their job, which is a totally different They're two completely different themes, and I feel it's really important to be mindful of that as we do this piece of work. Otherwise, it becomes a very, very large piece of work. Yeah. So the reason I wanted to come in really was to make an offer that the borough-based board considered how it can do a joint piece of work on quality to really make it much more transparent. It's the moment to do it, isn't it? Because of all the really good development stuff that's gone on with relationships and the learning through COVID, and it's an opportunity as we do the resetting to say what is important for this population. So I just felt if the energy is going to be spent on this, it would be really good to get a kind of output like that from it as to whether that would be a useful thing to do.
I think that sounds a useful thing. What does other members think? I think that's a useful offer. Thank you.
I think so.
Yeah.
Yeah.
People are shaking their heads. Thank you for that, Nancy. And can I just go to Maria Linford Hall, because I know you've had your hand up for a while.
Thank you. It's not a question. It's just to say that I think that to have an annual report is essential, and also that there's a quality control, and that perhaps if it can go to scrutiny, it has the opportunity to go to scrutiny. I think it will be a good idea.
Okay.
That's it.
Thank you. Councillor Charlie Smith. Charlie, yeah.
Just briefly, it's really about the importance of the lay inspectors. I see in the report it's just something about they're looking for a coordinator, really. I don't know how, if you like, the work is dished out. I imagine each lay inspector has a number of care homes that they normally visit, and whether that's actually being done. And that's where maybe at the end of the year you need a report saying how many visits have actually been carried out, were there any complaints made, and are residents aware of the fact that they can make a complaint. And is it, if they complain to a member of staff and that member of staff is unhappy about that complaint, they may not further that complaint until the lay inspector arrives. It could be nearly a whole year. But as I say, it's important we get those statistics at the end of the year at least. How many visits were made, how many complaints were received, and were those complaints sorted out?
Yeah, because I think we did mention this when we were reviewing the lay inspection, and we were talking to Age UK about revising the project, who's saying about the key things, because that's the only opportunity that service users and their families had to discuss about the service they were receiving. And we're saying that we look at how they actually deliver that lay inspection service, but is it about tightening up and being quite clear, but also at the same time making sure it fits into the contract monitoring cycle as well, making sure they're asking the right questions to service users and their families and getting the responses back. And how do we collect that, and how do we use that information? Because rather than just having it as a nice project and we hear from service users' families, we have to use that information in a constructive way, isn't it, to actually improve the service we're giving and any future service. I don't know, is anybody, Jeanette, have you got your hand up again?
I have. David did first.
Sorry, David Court-Thornton. Do you want to go ahead, David?
Thank you, Chair. Just to remind the Commission that all of the care homes are inspected and regulated by the Care Quality Commission.
Yes.
And so to the point that was being made earlier in terms of number of visits and opportunities to speak, local authorities used to register and regulate care homes in their boroughs when we had registration and inspection teams, and those functions and that funding was taken away from local authorities and the Care Quality Commission was established. So the registration of care homes, the inspection of care homes, both announced and unannounced, and the formal investigations into complaints and concerns about quality rest officially with the Care Quality Commission. And I think that's a really important aspect, because in getting a rich view of quality and the processes that enable people to get high quality care, I think we have to be mindful of the Care Quality Commission, because the Council and the CCG only commission a very limited number of care home places in borough and out of borough. And the fact that every care home is regulated and inspected and inspection reports are published, I think it's really important that to get the full picture, we take the richness and the special depth of the lay inspectors, plus the contract monitoring of both the two commissioners, key commissioners, which is the council and the CCG. But then also we remember that for about half of that provision is people independently going and, you know, taking a place in a care home, and the council has no role in their arrangements. They're entirely private arrangements. So the really, really important safety net there is the Care Quality Commission, and it might be that the Commission might want to say we'll have an annual report on care homes, but of course you can also invite the Care Quality Commission to come to that meeting, and you could ask them to produce a brief report for the Commission on care homes in the borough, and you could also ask them to present some intelligence and some data on how the quality in the borough compares with other boroughs, because they of course are in the unique position to inspect every provider in the country. So I just think I can almost kind of foresee that in a year or two's time, as we get deeper into this, you're really going to want to understand how we compare with others. And this is complex space because it's vulnerable adults and families, and there's lots of different eyes and ears that see what goes on in care homes. And we paid tribute earlier to the fantastic staff in care homes, but what we also know as well is that the leadership of care homes is very, very important. And if leadership changes, the ethos and the practice can change. And sometimes the early warnings of that are complaints from relatives or complaints from staff. So most people who have a concern will know to go to the Care Quality Commission. And it could well be a care home in our borough where we place nobody. So we have no direct relationship and we're not going in there. So I just wanted to say that the Commission are fully sighted on the various aspects, and to say that it might well be that in addition to an annual report, the Commission might want to invite the Care Quality Commission to come to that meeting and to give a brief presentation on their insight and intelligence on care homes in the borough, which is entirely independent of the council. But also you could then ask them, well, how does this compare to the other boroughs where you're inspecting too? And I think that would give a richness to what you're after. Thank you, Chair.
Thanks for that suggestion, David. Jeanette, you wanted to come in, and then Darren. You're on mute. You're on mute, Jeanette.
Sorry. So I think David's emphasised the point really that I wanted to make, which is there are different ways in which we are looking at quality, because there's different people going into the home. And one of the things we were very keen to do, which I think the recommendation speaks to, is around the fact that we want to make sure we're not duplicating efforts, so that the lay inspectors are focused on those that are unbefriended, or may not have family close by, and the contract monitoring officers who do go in quite regularly, at least quarterly, are going in and ensuring that people are safe. So I think it's about making sure we complement and work together, and I think that will be the test as you look at the report that you're proposing.
Okay, thank you, Darren.
Yeah, I just wanted to say that, you know, after this COVID-19, I'm sure that, you know, the officers and that have never spoke to care homes more before now, and this might be the opportunity to get some working together between the CQG, the council, and that, whilst you're all talking to each other, you know, pushing for this, you know, the COVID, that this is most probably the perfect opportunity to have a reset and work out what is actually the best way to make sure quality is upheld and who should do what. Might be this is the perfect opportunity to have that reset, a positive out of a dark period, but might be a good opportunity for you guys, QCC, the care homes. Most probably talk to the care home managers all the time now, getting everyone round the table, especially whilst everyone is buying for some help as well.
Yeah, I think that's a good suggestion. Thank you, Darren. Charlie, did you have your hand up? No. Okay. So let me look at any of the recommendations. We've already talked about recommendation about cabinet, an annual cabinet report on care homes would be useful addition. I think we've already discussed that already in terms about cabinet report, but having a report on care homes and stuff and bringing everything together. Right, let me see, is there any? Does anybody else want to comment on the addendum, the COVID-19, because we added that because that was for the recommendations that we put to the cabinet report on the council's response to COVID-19. So, you know, and we were told that the cabinet accepted all the recommendations in the report. So the 4 take proactive steps to coordinate weekly testing. The cabinet accepted all those recommendations from myself and the other members at the OSC meeting. Does anybody else want to comment any more on the scrutiny report? Because like I said, this is the second draft, but obviously it's not the final draft. So any suggestions, any thoughts and whatever, you know, if you can email that to Julie Trimble and copy me in, because for me, I think it's about, we start with where we have now and actually tweak it and take an on point, and Nancy's point, Darren's and everybody else's point about not conflating issues, keeping them very separate, being quite clear about collaborative partnerships, how that's actually going to work, and be clear and going ahead about have a better working relationship really, rather than looking at, you know, quality in isolation and bringing the best people to the table. If it's a case of inviting CQC later on in this financial year for them to discuss about where we compare with other boroughs, because obviously I think it's important, if we're going to do probably, let's do it properly and get the key stakeholders to actually report back to this commission, if we're here, or other people on the commission, to say this is where we are, this is where Southwark sits in with other boroughs in a proper way, and what we need to do to maintain the quality. Okay. Any other comments on the draft report so far, or we can move on to number 7? Any comments from anyone? Okay, we go on to item 7, COVID-19, the impact on the NHS. This is just the initial discussion, the impact of COVID-19. I think we've probably covered a lot of this today, but Sam Heppel-White, if you want to give an overview.
Thank you, Chair. I just got some sort of points to note, and then hopefully that will generate the sort of conversation, and we can go from there. So from an NHS perspective, obviously we went into, as the council did, a sort of a command and control system across the NHS, both nationally, regionally and locally. And for us in South East London CCG, we established an incident control centre. We worked with all the partners, and I think that some of that work has already been referenced. What we do know is up to the 18th of June, the number of people that have tested positive in Southwark was 1,280, and the number of deaths of Southwark residents was 244. I think what has also been referenced is that during the time that we have been in the pandemic, we've had a number of different guidance and policy documents. Sometimes there were literally a number of them on the same day. And there has been a lot of communication coming from the centre every day, not always in a timely way, ready for us to respond. I think we have had very clear instructions from the centre on how various services should be functioning and what services needed to be suspended. And there's been a number of standard operating procedures that were issued to various sectors. So, for example, around general practice. As you know, there was a nationally identified group of people that were branded as shielded, and they were vulnerable. So these people were included sort of organ transplant, patients being treated for cancer, people with severe respiratory conditions, and we know there was around 9,800 patients in Southwark who were identified in this group. So with regards to this group of people, we in Southwark took a very proactive approach to their management. We worked in partnership with the council on this, but our general practice teams very quickly got into a position where they developed a proactive template to work with those individuals. And I can say that in the last 3 weeks, over 8,000 of these people have been reviewed since the 16th of March. There has been some impact on people waiting for requiring treatment, as most of the clinical resources have been focused on patients with COVID symptoms. And as we talked about earlier on, we will start to see the impact of that. But there has been regular reviews of capacity around cancer services to make sure that some services do continue. Community services have continued to function during the pandemic, and we're focused on supporting patients to be discharged, supporting care homes and those people who have been cared for in their own homes. For general practice, we've seen a completely different model of delivery of services. The CCG distributed over 300 laptops into general practice very quickly, along with the equipment to enable video and online consultations. So this has resulted in all practices using this kit to make available to their patients video, telephone and online consultations. All practices are still offering face-to-face consultations once those patients have been clinically triaged and assessed as appropriate. And last week we had 32% of our consultations in primary care were delivered face-to-face, and the other 68% being delivered remotely. So all practices have remained open most of the time. So we've had a couple of little blips, but most practices have been open all of the time. There has been mutual aid arrangements between practices through the federations and the primary care networks, which means that patients have not had any impact on the access to their services for general practice. And interpretation services have remained in place during the pandemic to ensure that people can access these services. Very happy to talk about any other area, but I thought that would give you some headlines that we could generate the conversation for.
Okay, thank you, Sam. Take any questions from any members? David Noakes, go ahead.
Thank you, Chair. And thank you for the presentation, Sam. I mean, as far as our sort of death rate is concerned and the number of cases, that seems to be very similar to Lambeth. Do we have any sort of further breakdown of the statistics in relation to, you know, just how the different communities within Southwark have been impacted by COVID-19, and as far as those figures that you gave?
So I don't have too much more of a break. I've got a breakdown between different boroughs in South East London, and I've got the breakdown not only by borough, but unfortunately where those patients have died, whether it's care homes, home, hospice or hospital. I'm sure there's more information available, David. I just don't have it actually with me, but I've got that information which I can share with both Julie and Victoria to be circulated.
Okay. Do you know though whether, for example, of the 243 deaths, does somebody have, or is it in the public domain, about the breakdown in regards to age and ethnicity and things like that? Is that?
So that information is available. I just don't have it with me at the moment, but we can make that available. Yeah. Okay.
Can I ask one other question, Chair?
Yeah.
Yeah. I just wanted to ask about the other services, I guess. So like things like cancer services, like people going to A&E about potential heart attacks or strokes. Are you able to comment on what sort of level of, because certainly all the reports seem to indicate that there is still people are still not coming forward despite the sort of messages that the NHS is open. Do you have any sort of sense of what levels of uptake is now taking place, or how many people are still staying away?
So you're right, the activity has not gotten back to pre-COVID activities that we saw in both A&E and other urgent care services. And as you point out, there has been a campaign in order to encourage people to come back. I think that we can provide some data on the numbers that are coming through and the numbers that are being either admitted or treated. I would also say that there is obviously a new campaign that is going about to be launched or has been launched called Helping Us to Help You. And that just needs to be put in place due to the fact that obviously we can't have the same numbers of people sitting in any of our clinical areas if there is a social distancing required. So I'm sure we all have seen pictures and aware of just how many people could be in A&E at any one time during the winter months. Obviously, that's not going to be possible with social distancing. Helping Us to Help You is a system whereby the public will be encouraged to ring first and get either triaged to the right service or get an appointment time to reduce the numbers of people that are congregating in one area. But I can certainly provide I've got some information around the activity. It is gradually rising up, but it hasn't gone back to pre-COVID activity levels.
If possible, could we get those figures, or could
yes,
that
of course. Yeah,
I'll send those figures to Julie.
Yeah.
Thank you, Sam. Does anybody else want to ask a question? Okay, thank you, Sam, for your input. And if you can send those figures and information, because obviously the drill down sort of the ethnic monitoring, because obviously with the COVID we realise that is an issue, and I'm sure in Southwark it's not different from any other borough. Because it'd be good to see what the breakdown is and whatever. Okay, is there any questions to Sam on what she said? Okay, thank you for your contribution, Sam. If we go, so it's 10:02 now. Do we want to, rather than take a comfort break, I was thinking that we've only got a couple of more items on the agenda. Is everybody comfortable to go ahead for the next 15-20 minutes, or? Yeah? Yeah? Okay. If we go to item 8, scrutiny review, mental health, children and young people. I don't know whether everyone had an opportunity to look at the suicide briefing, which is from, right, let me see, from slide. So that's from Public Health Suicide in Southwark, looking at the Southwark figures. I mean, for me, there's nothing new in there in terms of, you know, the risk factors for suicide, etc., etc. And I think that it is one of the items, the themes that we discussed in our very first meeting this time last year, but there's nothing really in there. I think that I'm not surprised at. I don't know if anyone wants to comment on that, because it's just a briefing at the moment, and we could probably discuss it more at the next meeting in 16th of July, because it's a very brief, literally a very brief briefing. So any comments from commission members on the suicide briefing? No, I'll take that as a no. Okay. And COVID-19 equalities impact, I think that probably follows, I think it's initial discussion. I think this follows on from what David Noakes was saying about the COVID impact on Southwark residents, obviously with the BAME community and other communities who are at risk. And I've got here Public Health preparing a presentation on this. And for the next meeting, I'm hoping that if we get that before the next meeting we'll have a fuller discussion on the impacts, because we all know the severe impact. You know, the BAME community has been severely disproportionate right across the roles within the health sector, you know, in comparison to their percentage within the population. So I think it's important that when we get that qualities impact, we actually drill down and say, you know, because like I was saying, lessons learned, what could we've done in Southwark to prevent that, but also what can we do in terms of protecting the BAME community within the health service right across, especially social care as well, because unfortunately we don't want a second wave, and, you know, seeing what's in front of us and not actually preparing to make sure that doesn't happen again. Is there any comments on the equalities impact? Because obviously I think that's a crucial piece of work. Helen, you've got your hand up. Did you want to comment, make a suggestion or question?
Yes, please. It was just a question.
Yeah.
I was interested to know for that whether we would also be able to get related data on occupation, because obviously there's been you know, a lot of discussion about people in particular sectors, whether that's transport workers. I mean, obviously we've talked about kind of NHS and care workers, but security staff, you know, other professions that have been notably hit by COVID. I don't know whether or not we can get that data for Southwark for people who have passed away or who have been severely impacted by COVID.
That's a good question, and I think that's a question that I'd second as well, because I just think in terms of when we look at the job roles, I think it's really important we look at, it's not just doctors, nurses, all the way through from healthcare assistant, security guards, everybody within the NHS, but also social care as well. I think if we can ask public health to give as much as possible, but also I don't know whether the council to help them in that, because I think it's important we get as full a picture as possible. So maybe I can make a request to public health, but also make a request to Julie Trimble that if we can try and see if we can get as much of the picture in terms of employment roles and whatever in the BAME community, because that can
I just follow up? Yeah. Sorry, Chair.
Yeah, go on.
And just it's an obvious point really, but I guess as we're thinking about the kind of council's role, if there are particular sectors that are that have been impacted in our borough, it's then thinking then about how the different hubs, for example, can reach out to those particular groups, whether there are so I'm always kind of thinking with these issues about how the council's role particularly kind of dovetails, but so that would be really helpful.
So I think I can ask Julie Trimble to do that, because obviously, like you're saying, Helen, looking at all the other areas, employment, housing, whatever, how is it impacted, and look at the health role and see what we can do, because we need to be prepared as a borough. Maria, you've got your hand up. I've just seen that on your camera. Maria, did you want to ask a question?
Yes, I think that if you are going to look into any other areas that there has been an impact since COVID-19, I think it is the domestic violence and children that they had been in households of domestic violence. I have had a lot of reports on the people that I'm dealing with because of my charity that I run, that they are children that they are showing self-harm, beginning of mental illness, and I would like to have some figures of how much do you think, how big the impact has been.
You mean how big the virus on
children, especially
on children, mental health and well-being?
Yeah.
Thank you. Is there any other comments from members? Charlie?
Just very briefly, there's a big debate now about, as you've just been saying, about a disproportionate amount of people from Afro-Caribbean backgrounds, from Asian backgrounds, and maybe by a type of housing, the type of employment. But one of the things that I haven't heard at all is about the fact that for some groups, like Afro-Caribbean groups, Jewish groups, for instance, suffer from sickle cell disease. And I haven't heard anything said that maybe there's a link between that, because I mean early on there was talk about lack of vitamin D or something, but that was, I think, not proven in any way. I just wonder there might be a link between, because some of the Jewish groups have been reporting a disproportionate amount of people being infected with the virus, and I just wondered, you know, that's never been taken up, that's all.
Okay. Because I know with the BAME community, in terms of underlying health conditions, they were saying that unfortunately some minority communities have got more propensity to diabetes and other underlying medical conditions. So that was one of the reasons why. But obviously, there's I think a report I read last week was saying about South Asian communities, a particular underlying medical condition. So that would be a response. However, I think it has to be seen the whole entirety. In Southwark, we have got, you know, a very diverse population in terms of the COVID-19 deaths. Of that, how many have been in the BAME communities? And then you drill down, are they in particular industries or particular professions? And are they all frontline staff, healthcare assistants, whatever, nurses, doctors, whatever, or is it, or can't we make that causal link? Because in some boroughs it's quite clear, you'll be able to see there's a lot who are just based within the NHS and based within particular roles, and I think more work needs to be done with that. Can I just pick up, Helen, you wanted to ask a question, and then Darren, because I'm just looking at hands. Helen?
Hi, just to pick up on Charlie's, one of Charlie's points. I know I'm asking for lots of data, but if we also have the breakdown by housing tenure, I think that would be useful to know the extent to which this is, to which COVID has particularly hit those in our own kind of council housing. That would be helpful information.
Okay, thank you. Darren, put your hand up.
Yes, just wanted to, as well as the qualities of those that got COVID and sadly died of COVID, actually those that have been affected by, as Maria said, domestic abuse, etc., due to the lockdown, being stuck indoors, mental health with children, or, you know, the BAME housing situation, not being, you know, having a park, having a family. How has the qualities of lockdown people's lives as well? Not necessarily those that have got COVID or those that died of COVID, but other issues that have come up that may be more towards one group than another. And how we can sort those and help those.
Okay, just summarise, because what you're thinking, I think I'm asking Julie a lot of things, is about looking at the impact of the lockdown on certain communities, because that's probably highlighted the class divisions, but also highlighted the social inequality divisions in housing, employment, whatever, you know, in terms of, is it more people in the BAME community not working in those roles where they can work from home, so they have to put themselves at risk to go to work, to be in high risk situations. So I suppose that's quite a big societal sort of look at the impact on lockdown, on how is it impacting different communities in different housing tenures, Helen was saying, but also what's the consequence of that? Is it increased domestic violence? Is it worse mental health within those communities because of a result of lockdown? Because they haven't got the luxury to say, I'm not going to work, because they're in roles where they have to go to work, but also at the same time, I mean, we can even link that to the fact that schools were closed most of lockdown as well. Has that increased the issue in domestic violence and children being at home with, you know, with parents and carers who unfortunately are going to do them harm as well? I think, you know, if we look at everything, we could be here till this time next year. So I think there's a lot that we can put on the table, but reality is what that equalities impact is going to look like. Is there any other questions? Because I wanted to, because it's just about 9 o'clock now. I want to say that the work programme, we're going to discuss that in more detail at the next meeting, the 16th of July. I think that's about it. Is there any, David, have you got your hand again? Hand up again? David Noakes?
I'm afraid I have.
Yes, no, it's okay, because I keep seeing it. I didn't know whether it's clicked from the last time. Go on, David.
Just very quickly, if we're sort of moving on to the work programme, obviously I think we've got our next meeting on is it the 16th of July?
16th of July, yeah.
Yeah. I think you and I both got an email from Steve Lancashire and about some of the sort of other issues that are going on in the health sector. So obviously, since we last met, Southwark CCG has been replaced by the South East London CCG. And there's just some of these sort of bigger strategic developments taking place. And it's just about whether we need in any way to pick that up at the future meeting briefly on the 16th of July, or whether you feel that that should be dealt with by the JOSC, for example, that we both sit on. But I know there is some concern out there in the community about some of the bigger developments and changes that are happening in the health service and how it's delivered. And I know we can't do everything, but I just wonder if we need any update at our next meeting or a future meeting.
That's a good question. I think both. I think what we need to do is, I think we need to pick that up on the 16th of July, but also at the same time, before the 16th of July, maybe me and you need to discuss that, and maybe I think the JOSC, the Lambeth and Southwark one should pick that up as well, because if it's now, you've got your hand up, Sam, in terms of it's been replaced about South East London CCG, but also everyone's clear about what those changes mean and don't mean, because I think there's a lot of disquiet in the community and outside the community about what that looks like and how it's changed. Sam, you've got your hand up.
I was just going to say, I'm very happy to pull some information together, but I need to be really clear about what the question is that's being asked and what you would like me to include. Yeah. So if you have an opportunity to have that conversation, Victoria, with David, if the brief could be really clear, then I can certainly pull some information together for the 16th of July.
Sounds good.
Is that okay, David? Because I'm thinking you can talk on email and sort of draft, if you draft something together quite clear about, because I've seen Steve Lancashire thing, and I know that there's a number of people who are concerned about now that things are changing so quickly. What does that actually mean in terms of grassroots delivery? What does that actually mean to the communities affected by? So I think it's important. I think, David, if you do an email thing, we contact each other and say, well, this is what we want to find out from, so that CCG and the South East London CCG, what has actually changed? Is it just changing name only, or is it changed in terms of delivery? Is that all right, David? Notes, yeah?
Good. Yeah. Thank you.
Okay, we will discuss and obviously get back to you, Sam, to send a draft, yeah. To Sam. Okay, is there any other, there's no other business, anybody? But if there's no other business, if I want to close this meeting, say thank you all. Sorry, Helen, yeah? Sorry, Helen.
Sorry, Chair.
Yeah, no, you're welcome.
Just two quick things, just following on from David's point. This is maybe too premature, but certainly as a local ward councillor, I am interested in how COVID is impacting on the CCG's thinking about models of GP provision, just generally, because there would, we've got a lot of planning is still going on. We're still approving developments. And we've still got a situation, certainly in my ward, where we're thinking about kind of around Elephant and Castle, kind of what GP provision and capacity there is. And I think maybe that plays into the kind of discussion about the kind of strategic overview of things and direction of things, and whether there is still a kind of move towards more of a kind of hub model, or whether there's a rethink around that at all. The other question, and it may have been covered at the start because I missed the first item. It said on the agenda under the COVID briefing in relation to care homes that there was going to be a legal briefing on the Coronavirus Act 2020 Care Act easements is to follow. Does that mean we're taking that at the next meeting? Did I miss? Oh, it is. Okay. Because I know obviously that's very important, and obviously a lot of people have been quite concerned about the easements. So I just wanted to make sure that was going to be covered. Thanks.
Yeah, that's going to come at the July meeting. Yeah.
Yeah.
Okay. Is there any other business for anybody? No? Okay. Thank you all for attending tonight. Try to keep close to time. It's 9:05, and hopefully I'll see more of you again on the 16th of July. In the meantime, take care, stay safe. Bye.
Bye.
Good night.
Thank you, Chair. Bye.
You're welcome.
Bye.
Bye.
Bye.